All right, let's dive in. Looks like we're tackling urology and nephrology today. We've got medical textbooks, some case studies, even some quizzes from what looks like a paramedic handbook.
Should be interesting. The kidneys are pretty amazing, you know. People don't think about them much, but they're always working hard behind the scenes.
Definitely vital organs. Let's see, one of the sources, this urology.pdf, it talks about two big urological emergencies: renal colic and renal failure. Renal colic, that sounds pretty intense.
It can be. Imagine like this sudden gripping pain like in your side, and it shoots down towards your groin.
Oof.
That's renal colic. Often, it's a kidney stone that's blocking things up.
Oh, so it's like a blockage. Makes sense.
Yeah, and the pain gets so bad that people, they can't even sit still. You know, they're just constantly moving, trying to find any position that gives them a little bit of relief.
I can see why that would be an emergency.
Oh, yeah, definitely. Now, renal failure, that's a whole other story. It can be acute, which means like a sudden loss of function, or it can be chronic, where the kidneys slowly lose their ability to, well, to filter waste and balance fluids.
Right, and this source really stresses how serious acute renal failure can be. What makes it so critical?
Well, think about it. Your kidneys, they're filtering your blood nonstop, removing toxins, keeping your electrolytes balanced, even having managed your blood pressure. When they just suddenly quit, it's life-threatening, really.
Yeah, that makes sense.
Waste products start building up in the blood, and that can mess with everything, like brain function, even your heart rhythm.
And that's where dialysis comes in, right?
Exactly.
In fact, we have this case study from the paramedic handbook, case 17.1. It's about this 63-year-old man, Maurice. It seems his kidneys aren't doing so hot.
Let's see. Maurice is confused, incontinent, hasn't had dialysis in a week.
Mhm.
His son mentioned he's been wearing the same clothes for days, like his mental state has been declining.
And missing those dialysis appointments, that's a bad sign.
Definitely a red flag.
So can you walk us through what happens when someone like Maurice skips dialysis?
Sure, dialysis, it's like a life support system,
Yeah.
you know, for people whose kidneys have failed.
Okay.
There are two main types: hemodialysis, which filters the blood using a machine, and then there's peritoneal dialysis, which uses this special fluid that's put into the abdominal cavity to draw out waste.
Oh, interesting.
But without regular dialysis, the toxins build up, fluids get all out of whack, and things can go downhill really fast.
Speaking of imbalances, there's this test your knowledge question that asks about the effect of missed dialysis on the acid-base balance. What does that even mean?
Well, it's about maintaining the pH of your blood. When the kidneys aren't working right, acids can build up, and that throws off the balance. And even a tiny shift in pH that can affect your whole body, heart, nerves, muscles, everything. They all rely on that balance.
So it's not just filtering waste, it's about keeping this precise chemical environment inside the body.
Precisely. Dialysis helps to do that, you know. It mimics the kidneys, keeps everything in check.
So it's literally keeping someone like Maurice alive.
It is.
Wow. This is really giving me a new appreciation for my kidneys right now.
They're pretty amazing.
Now, before we jump to another case study, I'm curious. The answer section mentioned different types of dialysis. So what determines which type is best for someone?
That's a good question. It depends really on the individual, their lifestyle, their health, even personal preference comes into it. Some folks, they find peritoneal dialysis easier because it can be done at home.
Oh, I see.
Yeah. Others, they prefer the structure of hemodialysis, going to a clinic a few times a week, having that medical supervision.
Makes sense. So it's really tailored to each person.
It is.
That's fascinating. Okay, ready to tackle another case study?
Hit me with it.
All right, case 17.2. This one's about Laura. She's 40 and dealing with some serious flank pain.
Oh, flank pain. That often points to the kidneys. What else do we know?
Well, it says the pain's so bad it woke her up in the middle of the night she can't get comfortable. Oh, and she mentioned she was on a trip recently and that this kind of pain is totally new for her.
This is starting to sound like classic renal colic. Maybe a kidney stone?
Oh, right.
You ever heard anyone describe kidney stone pain?
Oh, yeah. Not fun. People say it's one of the worst pains imaginable.
It can be brutal. It's that intense, often radiating pain. The source describes it as coming on suddenly, and it just keeps getting worse and worse. Sometimes it even leads to nausea and vomiting.
Sounds awful.
And just like Laura's experiencing, people with renal colic, they often feel restless, agitated, always moving, trying to find some way to ease the pain.
Makes sense. The source mentions the pain can radiate down to the groin. Is that common?
Very common, yeah. Because the way the nerves are all connected in that area.
Oh,
The
well,
source also mentions it can come in waves. So periods of really intense pain, then
yeah.
moments where it kind of calms down a bit. Remember those muscle spasms we talked about earlier?
Uh-huh.
Those can make the pain even worse. As the ureter, that's the tube carrying urine from the kidney to the bladder, it tries to, like, squeeze that stone out.
It's amazing how much is going on inside when we feel pain.
It really is.
Speaking of which, there's another test your knowledge question about typical signs and symptoms of renal colic.
Well, aside from that intense radiating pain, you might see blood in the urine, nausea, vomiting, even a constant urge to pee, even if barely anything comes out.
So lots of potential red flags.
Yeah. And it's important to remember renal colic, it's a symptom of a blockage. It's not a disease in itself.
Oh, right.
So the treatment depends on what's causing that blockage.
I see.
Sometimes medication can help the stone pass naturally. Other times you might need a procedure to remove it or break it up.
So the medical team has to do some detective work.
Exactly. Figure out the best course of action for each patient.
Makes sense. It seems like it'd be crucial to see a doctor if you have any sudden severe pain in your side or back, especially if it comes with any of those other symptoms we talked about.
Absolutely. Don't wait on that one. It's pretty wild, how these two cases, Maurice and Laura, they kind of show the range of these urological emergencies. Chronic condition needing constant management on one side, and then bam, sudden acute event needing attention, like right now, on the other.
Really highlights how diverse this whole field of medicine is. And speaking of diverse, Maurice's case mentions a bunch of medications. One of the test your knowledge questions is about classifying them, and it just made me realize how tricky it must be managing multiple health issues like that.
Oh, absolutely. It's a juggling act for sure. Let's see. Maurice is on Altes. That's an ACE inhibitor, pretty common for high blood pressure, heart failure. Then there's glyburide. That's for type 2 diabetes. And HCT, a diuretic, helps get rid of excess fluid. It's not unusual to see this, especially with chronic kidney disease.
Makes you wonder how all those meds interact, right?
That's where having a good healthcare team is key. They can keep an eye on things. Watch for potential interactions, adjust dosages if needed. Make sure each medication is doing its job without causing, like, a whole other set of problems.
Right, like a balancing act.
It is, very much so.
So we've talked about kidney failure, renal colic, but what about the link between kidney health and blood pressure? It keeps coming up in these materials.
Oh, yeah. That relationship, it's a fascinating one. It's a two-way street. High blood pressure, it can damage the blood vessels in your kidneys, those tiny, delicate vessels.
Ah.
And when those get damaged, it makes it harder for the kidneys to filter waste properly.
So it's not just about the heart then. High blood pressure impacts the kidneys directly.
It does, yeah. And here's the kicker. Kidney problems can also lead to high blood pressure. It's like this vicious cycle.
How so?
Well, when your kidneys aren't filtering right, fluid builds up. That increases your blood volume, and that pushes your blood pressure up.
So damaged kidneys, higher blood pressure, more damage to the kidneys.
Exactly. It's all connected. Shows how intertwined these bodily systems are.
That makes me think, what can you do to protect your kidneys, especially if you already have high blood pressure?
Well, managing that blood pressure is huge. Lifestyle changes are often the first step, like diet and exercise.
Right.
And sometimes medication.
Yes.
It's all about, like, giving your kidneys a break,
Yeah.
easing the stress on those little blood vessels.
So those healthy habits we always hear about, they really do make a difference for our kidneys too.
They do. A diet low in sodium, less processed food that helps reduce fluid retention, lowers blood pressure, takes some of the load off your kidneys, and exercise, that's a winner too. Helps control blood pressure, improves circulation, good for your whole cardiovascular system.
So good for the heart, good for the kidneys.
Bingo.
It's all connected.
It is. And don't forget about staying hydrated. Water, lots of it, helps flush out toxins, keeps your kidneys humming along, like giving your internal filter a good rinse.
This is making me want to chug a whole bottle of water right now.
Always a good idea.
Now, before we wrap up our kidney adventure, there's one more common issue that keeps popping up in the source material. UTIs.
Ah, yes, UTIs. Super common, especially for women. They can be just a minor annoyance, or they can get pretty serious if you ignore them.
I've definitely heard of them. What causes them and how bad can they actually get?
Well, UTIs happen when bacteria get into the urinary tract, usually through the urethra. The source material mentions dysuria.
Dysuria.
Yeah, it just means painful urination. That's a common symptom, along with, like, feeling like you have to pee all the time. Sometimes you might even see blood in your urine.
So those are all signs that something's not right.
Exactly.
Yeah.
Body's trying to tell you something. Most UTIs are pretty simple, thankfully, and a round of antibiotics usually clears them right up. But if you leave them untreated, they can travel up to the kidneys, and that's when you get a much more serious infection called pyelonephritis.
So definitely not something to ignore.
Nope. Best to see a doctor if you think you might have a UTI.
Mm.
Get it treated quickly, avoid those complications.
This whole deep dive has been eye-opening, really. We've gone over how the kidneys work, the seriousness of things like renal failure and renal colic, the connection between kidneys and blood pressure, even common stuff like UTIs.
It's amazing what you can learn when you really dig into a topic.
Yeah,
And we've only just scratched the surface, really.
right. Makes you realize how important these often overlooked organs are.
They really are the unsung heroes of the body.
For sure. But before we get too sentimental about kidneys, I have one last question that's been bugging me.
Let's hear it. What's got you curious?
Well, we've talked about how these conditions are diagnosed and treated, but what about preventing them in the first place? What can we do to keep our kidneys healthy and maybe avoid these emergencies altogether?
A great question, and the perfect note to end our deep dive on, I think. It really comes down to making healthy choices, day in and day out. Those small things that make a big difference over time.
I'm all for simple but effective strategies. Tell me more.
So, prevention. When it comes to your kidneys, a lot of it boils down to a few key things. And honestly, staying hydrated is probably the biggest one. Think of water as like your kidney's best friend.
Okay.
It helps flush out all that waste, keeps things moving, and helps prevent those minerals from clumping together and forming kidney stones.
So 8 glasses a day, they're serious about that.
They are. And, if you're exercising, hot weather, things like that, you'll need even more. Listen to your body.
Right. Makes sense. So water's key. What else can we do to keep our kidneys happy?
Well, a healthy diet is huge. Lots of fresh fruits and veggies, lean protein, whole grains, those are your winners. Cut back on processed foods, sugary drinks, and too much salt. That'll do wonders for your blood pressure, which we know is good for your kidneys.
It's funny, we always think of healthy eating as being for our hearts or our weight,
Yeah.
but it's clear the kidneys are a big part of the picture too.
Oh, absolutely. And don't forget exercise. Regular physical activity, it's like a tune-up for your whole body. Helps manage blood pressure, gets the blood flowing, all good things for your kidneys.
So all those healthy habits we hear about all the time, they're not just fads. They really can help keep our kidneys healthy.
They do. And here's one more thing to keep in mind. Be careful with those over-the-counter pain relievers.
Oh, like ibuprofen?
Yeah, ibuprofen, naproxen, that kind of thing. In the short term, they're fine. But if you use them a lot, long term, they can actually damage your kidneys.
Interesting. So everything in moderation, and probably a good idea to check with your doctor about any medications you're taking regularly, especially if you already have kidney issues.
Couldn't agree more. Knowledge is power when it comes to your health, right?
Mm.
The more you know about your body, the better choices you can make.
Absolutely. Well, this deep dive has been amazing. We've learned so much about how the kidneys work, how serious these urological emergencies can be, and even some simple things we can do to protect our kidney health.
It's been a fascinating journey for sure. I hope our listeners have come away with a newfound respect for these incredible organs.
I know I have. So to everyone listening, thanks for joining us on this deep dive into the world of urology and nephrology. We hope you've learned something new and feel empowered to take care of your amazing kidneys.
Keep learning, keep exploring, and take good care of those kidneys.
And that's a wrap for this episode of The Deep Dive. Until next time, stay curious